Hi, welcome to the next talk. Today we're going to be talking about the UK medical training pathway. As it's the end of Careers Week, I want to touch on this subject to give you an idea of what's possible and available after medical school and the various training pathways that are open to you. So let's start in medical school. This will last anywhere from 4 years for a graduate training programme up to 5 years for an undergraduate training programme. This may or may not include an additional 1 year for those who want to intercalate. This is a year of research which is optional at some universities and mandatory at others. So as you can see, medical school can last anywhere from 4 to 6 years. After the end, most UK medical graduates will enter what's known as the Foundation Programme. This is a 2-year training programme which consists of the trainee rotating through various medical, surgical and GP specialties to give them an idea and flavour of what it would be like to work in those specialties. This is 4 monthly placements and therefore there are 6 in these 2 years. It's worth noting that there's a variation of this as well, known as the Academic Foundation Programme. This is exactly the same as a foundation training programme, except that one of the 4-month blocks is dedicated to academic time to perform research for the trainee to see if that's something that they would be interested in pursuing in the longer run. After foundation years, there are several options that are available. Looking at these one by one, the first one would be entering what's known as General Practitioner Specialist Training. This is a 3-year programme in which the trainee spends 18 months in hospital medicine and 18 months in general practice. There are postgraduate exams to pass during this time, but successful completion of this will culminate in you being a fully qualified general practitioner. One of the other options that is available is what's known as ACCS. This is acute critical care and emergency care as well. This is a 3-year programme that is focused on those interested in these specialties. It consists of 4 or 6 monthly placements in emergency medicine, acute medicine and anaesthetics. The 3rd year of this is a full year spent in the specialty of your choosing. For example, you could be an ACCS trainee who is emergency department themed, and therefore you'd spend the first 2 years in the emergency department, anaesthetics and acute medicine, with the final 12 months in the 3rd year in emergency medicine. And that's the same for an anaesthetic themed and an acute medicine themed ACCS trainee. After this, you'll be able to apply to specialist training, which can last anywhere up to 4 to 5 years. After the end of this, you will have obtained your certificate of completion of training and be either an emergency department consultant, an acute medical consultant, or you may be an anaesthetic consultant. This depends on which specialist training pathway you've entered after performing the ACCS. The third option available is entering a surgical training pathway. This is for those people who are interested in becoming surgeons. It's a 2-year programme with 4 to 6 monthly placements for those 2 years in various surgical specialties. There are also themed programmes for those people who are interested in a specific specialty. There are surgical training programmes which have more time in that specialty or allied specialty. For example, I did core surgical training programme, which was orthopaedically themed, and therefore I did 12 months in orthopaedics, with 4 months in plastics, 4 months in general surgery, and 4 months in intensive care. After these 2 years, in which the membership of the Royal College of Surgeons postgraduate examination is required, you can then apply to specialist training. This will take 6 years in a specific surgical specialty. The Fellowship of the Royal College of Surgeons is required as a postgraduate examination during this time, after which you can obtain your certificate of completion of training and work as a surgeon in a specific specialty. One of the other options after foundation years is for those wishing to become hospital medical doctors and physicians. This is known as IMT, or Integrated Medical Training. This is a 3-year program with 4 to 6 monthly placements, rotating around various medical specialties, such as cardiology, respiratory, gastrointestinal medicine, rheumatology, and so on. The membership of the Royal College of Physicians examination is required to be completed during this time, after which you can apply to specialist training, which can last anywhere from 4 to 5 years. Again, after this successful completion of this, you will obtain your CCT and be able to work as a hospital doctor. Now, these are the 4 traditional pathways that are available to you after foundation years. However, it's worth noting that there are various other pathways that you could embark on as well. One of the most popular is to have what's known as an F3 year, Foundation Year 3. This is not a training pathway as such and lasts normally 1 year, although people have done FY 4 years as well. For those people who are not set on a specialty or an area of medicine or surgery, this gives another year and time for them to trial trust grade doctor jobs in various specialties. Alternatively, it gives the flexibility for the trainee to either locum or to do something completely outside of medicine for that 1 year, including travelling abroad and working in experiencing healthcare in different countries. After the end of the foundation year training program, there are several things that the trainee can do. Firstly, you can either apply to any of the above specialties or training programs, or alternatively, do something completely different outside medicine. In addition, there are other academic streams that run alongside this. For those after foundation year, whether you've done an academic foundation year or not, you can apply into what's known as an ACF. This is an academic clinical fellowship. This typically lasts 3 years, the end of which the trainee will be expected to carry out a PhD or research of some sort, which can take anywhere from 3 to 4 years. After the end of this PhD, the candidate can then go back into specialist training in any of the areas that the PhD or the specialist training pathway was in, or may do something completely separate. These are the main areas and training pathways that are open to you after you finish medical school. Whilst there are certain careers which are known as portfolio careers and do not fit into any of these and can allow you to do or make up your working week as you would like. For example, as a general practitioner, you may either be a salaried GP working at a practice, you could be a GP partner where you have ownership in a certain practice, or you could be what's known as a portfolio GP. This is for those people who want to spend some time working as a general practitioner and may want to explore other interests they have or have a heavy involvement in, such as teaching at local universities. There's a huge range, I hope you can see, of options available to you. And if you're interested in any of them, I would urge you to speak with people who have gone through these pathways when you're on your medical placements or around hospital to get a better idea. I hope that was useful. If you have any questions or any further ideas for any content you'd like, feel free to message. Please like and subscribe, and I'll see you on our next video. Thank you very much.